Hey guys, welcome back to the Nurse Aspect, where we assess and evaluate. I am your host, Nurse Becca, and today we have on the show Nurse Mathew. What's up?
What's up? What's up?
Good. How are you doing?
Good.
How you
Can't complain.
feeling?
Great.
Thanks so much for being here.
Oh, not a problem.
Gonna get right on into it like always. Why'd you get into nursing?
That's a good question. Why did I get into nursing? I think I've always had this, want to help people in a healthcare way, I guess. Like make sure they take care of themselves. And I don't know if my mom being a nurse has anything to do with it.
It's always
maybe,
like there's always a nurse in every family.
Yeah, maybe that's another thing that kind of pushed me to being a nurse, and also just on I knew that it was a very flexible profession, and that it'll give me different avenues that I could later go into.
Okay.
Yeah.
So what'd you do?
In nursing?
Yes.
So for nursing wise, I started off home care. I did med surg. I did step down, ICU, rehabilitation clinic, a cardiac rehab, and also I'm still currently doing practicing as a CRNA in the Army Reserve.
Okay.
Yeah.
Well, I heard CRNA and I heard dollars dropping. I heard the money dropping.
Oh man.
Well, what made you want to become a CRNA?
It wasn't the money dropping, but it was really I loved my time in ICU.
Yeah.
Yeah.
Which ICU were you in?
So I worked in the mixed ICU in a hospital in Brooklyn. I'm not gonna say the name.
That's cool.
But,
no problem.
The experience there kind of prepared me really well, because that was my first hospital where I did med surg, step down, and ICU. And my ICU was a mixed ICU, so I got a chance to take care of MICU patients, patients with neurological issues, of course, surgical, medical, once in a while H codes, and emergencies. So it was a well-rounded. It wasn't
It sounds well-rounded.
Yeah, it was a really well-rounded. They did actually produce a lot of CRNAs actually.
Oh yeah?
Yeah,
Wow.
low key. They produced I have coworkers that there's one coworker that I actually ran into at a hospital I work at now, and we were in the same ICU together.
Oh wow.
I watched him. Yeah, I watched him leave. I think he left. Yeah, he left a year before I did.
Okay.
Yeah. So it's cool to kind of come back full circle.
That's dope.
Yeah.
What was the process like in terms of going through CRNA school? I know it takes a while to get your CRN and applications. Did you apply to a bunch of different schools? Was it easy for you to get in? What was your experience like?
My experience, first I didn't diversity CRNA that group kind of helped me to kind of form a path and get on board with what I needed to get completed in order to apply. And also they also gave support while I was in school, and they of course checked on me when I was out. So diversity CRNA, that's something I would highly endorse. Anyone who wants to become a CRNA, there's a group that they'll do airway simulation labs at different universities. They'll basically kind of introduce you into this new new field that you want to go into.
That's dope.
Yeah, and it was just kind of word of mouth. The person that really told me about diversity, I met her while I was away for some Army training I had in Texas.
Okay.
Randomly.
Oh wow.
Yeah, we randomly kind of we were not hit it off, but we were cool.
Y'all meshed.
Yeah. We meshed well, and I found out she was done with CRNA, and she kind of told me about her path, and what helped her, and it shaped me right up.
Wow.
Yeah.
Didn't happen by accident.
Yeah,
I'm
that's
always
what
like
like
nothing happens by
yeah, it didn't
accident.
happen by accident, and also like that was just the next. I felt like because I enjoyed ICU, um, that would just make sense to go into CRNA school. But I do like the numbers, the like I knew I'd be able to support myself and my family
Okay,
by doing that route.
that's cool.
Yeah,
Did you apply to like a bunch of schools or no?
a
Do you
handful
remember?
of school,
Okay.
probably like five.
Okay.
Yeah. But the school that I graduated from, I got rejected from.
What?
Yeah.
What?
Yeah.
What
Yeah.
happened?
I got a rejection letter from this same school. And I emailed the secretary. I'm like, yo, what do I do to be a stronger candidate? And she told me, and I was like, all right, bet. So I did what she said would strengthen my resume, because she said they like what they see, but with that class that was entering, like it wasn't as strong as that class, like my resume, my overall profile. So I took that class and took one other class. It was like this intro to anesthesia course that Barry University offers online, to kind of like, add my stats and really show that I was serious. And like the following year I got accepted. I got an
Wow.
interview. Then after that, I got accepted.
That's
Yeah, I
dope
always tell
though.
people that. Like, yeah, the school I graduated from, I got rejected from.
Wow.
Yeah,
And that was like a year or so later?
yeah,
Wow.
yeah.
So it's just an anesthesia course that you took and a class that she said,
And two classes, two
two
courses.
classes.
Yeah,
Wow. So
yeah,
it's just really the timing of it.
yeah. And just being consistent, being persistent. Like sometimes, like I don't mind somebody telling me what like my faults are, like my discrepancies. Like I don't
Mhm.
like that's so you have to be aware of them, just so you know what you're really facing, and just so you know, like, hey, did you put your best foot forward? So like by me not doing that, or like if I didn't do it that way, I wouldn't know
Yeah.
how, like what would make my portfolio stronger. So
Yeah.
I don't know. To me, like you might look at it like I'm crazy and took the risk to do that, but I don't know. In my head, I'm like, yo, there was nothing to lose.
Honestly, I don't think that's crazy at all. That's a word in a word. You know what I'm saying? Like I
Yeah,
feel like
like
that applies to anything in life, and just being consistent. Like keep on trying, keep on pushing. Whatever.
yeah,
If it's for you, it will always be for you. But the consistency and the passion that you
yeah.
put
And I feel
behind
like
it is what really makes
that
a
is
difference.
key. Like what you said, like like I grew up in a very like religious community, and like we always preach like, oh, what is yours is yours. I'm like, yeah, but God needs you to work.
Yeah,
He
because
needs you to
guess
put
what?
the
He'll
ball in
take that right on
motion.
from you
Yeah,
and
he
give it
needs
to
to.
someone else.
Yeah, he'll
Yeah, that's
take.
true.
He will.
Yep.
I've seen it. Like
Yep.
he will.
Yep.
So like it's, and because it's not something that is easy.
Yeah.
I'm like, yo, you in a lion's den. It's kind of like,
Yeah.
yo, what are you gonna do?
That's
Like
a
you gonna
fact.
fight, or are you gonna?
Now, if you want to lay down, you want to lay
Yeah,
down.
but you're gonna get hit.
But
Like,
after that, after you lay down,
but you're gonna get hit,
and that's
and the
true.
hit is gonna hurt.
Yeah.
But it's okay. Like, what
Right.
are you gonna do after you get hit?
They always say disobedience is better than sacrifice.
Yo,
Right?
and was crazy enough. Like, I did another interview, and like, they told me the percentage of like black males in nursing. Then they told me the percentage of black males that go on to get like higher degrees or even like CRNA. And yo,
The number's small.
oh,
The
that number
number is
was
super small. Super
depressingly
duper,
small. But
yeah.
that is actually not my world.
That's
Like
not your. That's
that,
exactly.
like,
That's not
cause
your view.
I have like 3 friends, like direct friends that are nurses.
Oh, nice.
Yeah, so those stats did, like I looked at them, I'm like, man, like that's not my world at all. Like I have a lot of like homies that are like black males that are in nursing.
That's great.
Yeah,
That's
which
dope.
is like, which is a little, it was just strange to me, but yeah.
All right. In terms of like CRNA school, like the school that you went to, how do you feel like you enjoyed? Well, first of all, before you tell me that, did you get into any other schools after you strengthened your profile? Did you get into any other schools or no?
No, that was, I think the second round I might have just applied to 3 schools,
Okay.
but they caught, like I feel like they didn't give me room. Like once I did the application, I went like reapplied. I think they called me right away.
Okay.
Yeah, so I did apply to other schools, but it didn't even matter.
Okay.
Yeah.
What was school like for you?
And like in terms of course, it was hard. It was challenging, but the school I went to was very supportive.
That's good.
Super supportive. I went to school during COVID too. And my program director and the staff, they still graduate all their kids. We still got the clinical times that we needed. We still got all the experience that we needed. They did a. I was kind of like surprised by all the help and resources and how they kind of like you felt that they were there to kind of like push you to win,
That's good.
push you over. And I appreciate it. Like I always think like I'm fortunate because that's not everyone's story.
Mm-hmm.
But yeah, I'm very very fortunate. That was their culture over there.
Okay.
Yeah, and I always like highly like whenever I'm like applying, I'm like, yo, I don't know for any other school. I actually work with the director of another program.
Mm-hmm.
He's my chief.
Oh,
So,
wow.
so yeah,
Okay.
he's my chief. So but he knows like what school I came from. He's actually very cool with the assistant director of that school.
Okay.
So like I caution not I'm not talking like down about like his school. It's just like I could only speak for my school.
Yeah.
My school I loved it. They rocked. Like
Okay.
I remember writing my I felt like they looked at my letter that I wrote to them for admission and they really like read it. Like because the interview and how like they like took me over the hump. Like you can't I feel like that's school. Like that's what they're supposed to be doing.
Mm-hmm.
But you know, when you see someone actually care and do it, it was different.
Okay.
Yeah. But
That's
yeah,
cool.
I love my program.
That's good.
Yeah.
That's good. I feel like that's like half the battle.
Yeah, it is, and it's a huge battle.
Mm-hmm.
It's a huge battle because when you're in the battle, you're gonna have many battles, and you're just gonna have to fight until you're done, and even after you're done,
Right.
you still
You still
gotta
not done.
yeah, you're
Yeah.
still not done.
Yeah.
Because now you're gonna like you're gonna hopefully turn into the provider that you want to
Yeah.
turn into.
What do you love being about CRNA?
Oh man, what do I love about it? I don't know, just the autonomy that you have, like while you're intra-op formulating formulating this formula that you think like, man, like this patient is not gonna have any pain, any the vital signs are gonna stay stable, and all of this is just like all this brain activity that's happening, all this brain work, like trying to solve, not solve, but trying to like basically like take off and land like without take off and land safely basically.
Okay.
And all the work in between that is fun to me.
Okay.
So and you still get to care for patients, you're still being their advocate, you're still looking at like their history and trying to figure out what is the best care plan for them. And I like the fact that it's very individualized, and we have something called the art of anesthesia. And I always tell my students like, hey, like I'm gonna teach you one way, you're gonna get taught the same thing like a little different way.
Yeah.
And your job is just to pick what works for you.
Right.
Because like I have induced differently. I have like there's so many things within anesthesia I've done differently, even if it's once, with a different doc, because you're always learning. Some people come have some cool ways of like getting their work done. It's always dope, like learning it like on a run. Yeah.
Honestly, I totally agree with that. I used to precept on my old unit, and I would tell people pretty much the same thing. Like, I'm gonna teach you in a way that works for me.
Yeah.
I'm not teaching you the Jaco way. Okay,
Yeah,
so you
yeah,
ain't hear
yeah.
nothing from me.
Yeah,
But like this is how I do it. Like whenever I'm off and you're on, like if you take it from someone else, just take it with an open mind. You gotta have an open mind,
Yeah,
and then
you
you
have
take bits
to.
and pieces,
Yeah.
and you make it work for yourself.
Yeah.
Like what I'm doing, like it's just might not work all the way for
For
you, but
yeah.
but also don't get too comfortable with like even if you enjoy my way,
Yeah.
you always got to be open.
Open,
Nursing in
yeah,
general is it's a big mosh pit of change. You can't get
Yeah.
used to just the one way of doing
Yeah.
something, being stuck in that mindset, which is why sometimes I feel like when you're in a specialty, you get so stuck in the mundane of like how you normally do things, and I just feel like you just get so complacent that like when something the slightest thing happens, like people like
Yeah,
now want to fight
yeah,
their assignment, people want to
yeah.
whatever, but you gotta always be open to change. Like,
And that was another thing I enjoy. So within within a week, I can be when someone asks me like, "Oh yeah, like what's my week look like?" So I work different hours depending on the day.
mm-hmm,
So well, like last week was, Tuesday, Thursday, 12 hours. No, Tuesday, Wednesday, 12. Then Thursday, Friday, um, 9 hours.
mm-hmm,
But like on Tuesday, I could be in L&D.
mm-hmm,
The next day, I'm in cath lab. The
mm-hmm,
next day, I'm in the OR.
mm-hmm,
The next day, I'm in endo. I
mm-hmm.
love like being in all these different like
Yeah,
specialties because, like you said,
you
like
see it
you
differently.
see
Yeah,
differently.
it's not the
Like it's
same.
not the
Blah blah
same.
blah.
Yeah,
Yeah,
I enjoy that a
yeah.
lot.
Is there anything you don't like about being a CRNA?
Um, nah, there's nothing I don't like about being a CRNA.
Which area of nursing was like the worst for you? Or which area of nursing would you just for sure I would never set my toes in there?
I don't have one.
You don't have one?
No,
What?
nah,
That's crazy.
I don't. I
I'm
don't
always
have
like,
one. So going from med surge to step down to ICU,
that's a gradual increase.
that's a gradual decrease.
Why? I feel
numbers
wise. Oh, in terms of like the
taking care of patients. Yeah,
I mean, yeah,
my
but
numbers
in terms of like
decrease, but like
depends on where
I
you
don't
look at
mind
it.
I don't mind the brain work of ICU. Like
Okay.
having to just focus on 2 patients
Mm-hmm.
and all like it's more like critical, but like I rather focus on 2 versus having to focus on 3, 4.
6.
That is nice, but like I didn't hate the fact that I had to focus on. I did this stepwise approach, which is not as that just happened to be how like my path. Yeah, it wasn't intentionally done.
Mm-hmm.
It just so happened that that's the route I went. But like, I did not like home care. The only thing I didn't like about home care and why I couldn't be a home care nurse is just like, when I clock out, I clock out. I hate paperwork after hours. Like, don't call me. Don't I hate paperwork after hours.
And it'd be for the most tedious things.
And I'm like, my joke is, English is not my first language. And I'm not. Don't I might forget seeing this patient and what I saw. Like just having to go back, backtrack, because sometimes that's what you have to do with these patients. You got to backtrack because there's certain neighbors, they said it's not the safest. So you in and out. You jot a little note and you bounce.
How long were you in home care? Do you remember?
Probably. So I was in full-time home care for a few months.
Okay.
A few months.
I remember when I was trying to get a job, I was applying to everywhere, and home care was definitely one of the places I applied to, and I could not get my foot in the door. And I'm like, it's home care. Why is it so hard to get in
you
here?
need hospitals.
I understand why now, being on
I look at my cousin sometimes. I'm like, you bug, because he doesn't have a hospital. I'm like, you need
that's crazy.
Why do you need hospital? Because that's your background. That's your foundation. That's your foundation.
Yeah.
Like med surg is foundation for nursing. We can't talk bad about it. Like that's your foundation for nursing.
Right.
Like it is what it is. Like you call it whatever way. Like I have even seen it through time. Like one of the compliments me and my study buddy got from one of our preceptors in labor and delivery is like, you guys, and we're black males. He's like, you guys understand how to talk and care for your patients, and you can just tell that. And me and him both have 10 plus years in nursing. Not just ICU, we've been around.
Yeah.
And med surg is a foundation of nursing.
Yeah.
That will help you with community health. That will help you with your step down ICU. It's really important.
That's the truth. I can definitely understand that. Working in med surg really gave me the background in terms if I could relate it to, let's say somebody is trying to go into home care, you need to be able to one, assess your wound. And even let's say you
Yeah.
learn it in a book, okay, that's fine. But you still have to talk to your patient. Your
Yeah.
patient, like, what are you gonna do if your patient's like, I have these medications and I don't really understand that? You're gonna tell them to go to the hospital. Like certain things that you should be able to answer just
Yeah.
if
And
you
that's
have
part
a
of what we do.
background.
Yeah.
Yeah. Even like, and as a nurse, like you're everything. You are the therapist. You are like, there's times when you might be, you know, let's say you're drawing blood, but as you're talking to your patient, you see that your patient is showing signs of suicidal ideation or, you know, whatever. Like now there's psych issues
Yep.
that, you know, like it does make a difference to have a background with a basic foundation. I don't think that you necessarily need a year of med surg. Like, I think that's
Like those
wild.
all those numbers when it comes to like,
That's
you need
crazy.
6 years, whatever.
But
Like
you need a little
you know
time.
when you're gonna I feel like you'll know when it's time to leave.
Yeah, that's for sure.
Yeah.
Thanks for listening to another episode of The Nurse Aspect, where we assess and evaluate. Keep it locked in next week for part 2.